Wonderful. It is now time, y'all, to get into our panel discussion. So everyone, please help me give a warm welcome to our panelists. I will introduce them and read their bios. So we have TaVia Wooley-Iles. TaVia is a native to the Antelope Valley. She has spent over 20 years in the social services field working with and advocating on behalf of families in need. As a mom to 5 children, she now spends time advocating and educating others on the importance of Black maternal health and ensuring that the birthing individual is seen and heard. Welcome, TaVia. We have Sakari Lyons. Sakari means brown sugar or something sweet in Swahili, and she has lived up to her name. She holds a Bachelor of Science degree in criminal justice and sociology, a master's degree in social work, and has been leading the Solano County Black Infant Health Program for over 13 years. She's a part-time professor at Cal State East Bay, her alma mater, and in the master's level social work department. Ms. Lyons is a mother of 5 children, a lifelong partner to her honey, the love of her life, and is a proud member of the Alpha Kappa Alpha Sorority Incorporated. Welcome, Sakari. We have Taleia Wheeler. Taleia is a creative artist whose resume includes radio, stage, as well as in front of and behind the camera. Her clients or employees have included Disney, the New York Knicks, Nike Communications, and the Kennedy Center, to name a few. Her most recent work can be found puppeteering and voicing characters on Netflix's Waffles and Mochi and HBO's A Black Lady Sketch Show, season 3. She is a proud member of Delta Sigma Theta Sorority Incorporated, and with her most recent role of being a mother, she has no days off, but the payout has been priceless. Welcome, Taleia. And we have Dr. Zea Malawa. Zea is a mother, pediatrician, and public health professional committed to improving health outcomes for children of color. Upon completing her undergraduate degree at Columbia University, she earned a medical doctorate from UCLA and a master's degree in public health from UC Berkeley. Currently, Dr. Malawa is the director of Expecting Justice, a public health program that uses systems change and justice-oriented approaches to close the racial gap in birth outcomes. She also sees patients at Mission Neighborhood Health Center in San Francisco, teaches anti-racism at UC Berkeley, and is the vice chair of San Francisco's First 5 Commission. Welcome, Zea. And thank you to all of our panelists for joining us and sharing space with us today. So as we shared earlier, we just published our groundbreaking report, The Road to Black Birth Justice. And in the report, we have dozens of recommendations for anyone from policy and county leaders to clinical and social service providers to CBOs. Is there a recommendation that is meaningful to you that you want to share or highlight? That's the first question. And we will start with TaVia.
All right, well, it's morning still, so good morning, and I'm TaVia, and I just want to give you a quick disclaimer. Remember that mom part? I'm a mom who homeschools her children, so if you see me look, just know there's little ones around, okay? So, and if I give that look, you know I'm talking to them. All right, so thank you for having me. I really appreciate this opportunity to share, and I don't know if I'm able to disclose, but one of the quotes that was, I think, on the first scenario was actually mine. And so the recommendation that really stood out to me the most was provide respectful care. As stated in the quote, pregnant 7 times, given birth 5, 4 children. I felt like I was not seen or heard or even given the dignity or respect as a birthing individual throughout the entire process. I've never had a positive pregnancy birthing experience. And when I would hear positive outcomes, I'm like, oh, is that's what's supposed to happen? So I think that's the biggest recommendation I have, is that so many of us, myself deeply, understanding that we are not seen or heard, acknowledged, taken seriously. Oftentimes people will walk into the room and tell me what they were going to do, as opposed to asking me what I would like to happen. I didn't even know that was a choice. I just thought I had to listen to whatever you told me. And now looking back, that was definitely the wrong approach. So that is the one recommendation that I think if immediately implemented, we could ideally see some changes. So thank you.
And that's not asking for much, right? I think we deserve that.
Yeah, very much so.
Let's go to Sakari.
I stand behind all the recommendations. They're real. They didn't come from a crackerjack box. They came from true lived experiences. And what I know to be true in terms of recommendations is policy is really the change maker. So I want to address the state leadership policymakers, support the implementation of California's CB 65, and read the report. You got to read the report to know what we're talking about. And so what that does is it extends postpartum follow-up care. So in the scenario where a mom has to juggle whether she's going to go back to work or not, that shouldn't be an option. She should be able to raise her children the way that she sees fit. I also want to state the county leadership in terms of advocating for restructuring funding mechanisms to make hiring and retention of Black professionals, as well as increased pay and priority. The work that we do from a county leadership level is hard work, but then it does have its costs, so pay. And then lastly, I will say programs and services providers increase the stipend amount to pay for program retention. Our mom stories are very, very true. We always look for this population to speak their truth, but what does that mean? At what cost? So when I say pay, I'm not talking about stipend, but I am talking about stipend, but I'm also talking about, provide food for that family when you're taking our mama away to share her experience, provide transportation, provide childcare, and then recognize her when you talk about the data. Her name needs to be said. And so I'll say those three.
Thank you, Sakari. Absolutely. Let's go to Taleia.
Thank you so much, Taleia. I think they said it great. Perfect. Coming from a creative standpoint, I'll be frank with you. I don't know all of the policies that are currently in place. What I do know is the research that I did on my own. And that was because someone, basically many of the birthing moms I knew of mocha moms. And my friend gave me the information that they had, which was, hey, you might not be a part of this group yet, but we know, and we have so many advocates on here, so we're going to give you information. So one of the things I did is I sought out a doula. So then once I sought out a doula, they told me, hey, this is what you should know. Get into this, find out your rights so that you can advocate for yourself. And thankfully I did, and my doula came to me for free. And that's not standard. It was because I looked into programs that help women of color have advocates. So it worked perfect. It worked in my county, in LA County, and I was able to use that. And thankfully I was able to connect with this woman, and she gave me some information that I didn't know. And as a woman who was going to birth in a pandemic by myself, I knew things that I would have had no idea because of a doula. So I say, look into the resources that are out there that are for within your counties. You will be surprised how much money counties have that they want to give into the communities that are just sitting there because people just don't know about it. Talk to other moms. So coming from, like I said, on the creative side, not having too much familiarity about the policies in place, get in contact with the moms and just talk.
Thank you, Taleia. And that's one of our recommendations too, right? I think we need to be sharing more about these policies so that folks have the information that they need, right? So I absolutely agree with you. Let's go to Zea.
Hi, everyone. I want to thank you for the honor of being able to share space with these lovely panelists. And thank you, everybody who came to this rally and showing your commitment to this important issue. So thanks for this opportunity. I also agree with Sakari. I stand by all of these recommendations. And, the reality is that many of them just are not even asking that much. And so although, the list takes up 2 pages, it doesn't seem like it should even be an either or thing. I think it's an all at once thing. But the things that I want to lift up right now, one of the things that I think is really important to talk about is that, last year, the governor signed into law the California Momnibus Bill, SB 65, that Professor Lyons also referenced. And that provides a lot of really amazing things like extension of postpartum care, but we haven't actually crossed the finish line with a number of the items from SB 65, because for one thing, we're still in the process of advocating for funding for SB 65 to make sure that all of the things that we brought to life actually come to the folks who need it. And then the other thing, and this is the thing that is really frustrating, is that, one of the major provisions of that bill is to have doula coverage, Medi-Cal coverage of doula care, so that folks who cannot afford to pay for doulas out of pocket and don't have insurance that covers doulas, if you're on public insurance, you can still access this service. And, we know it's like not a debatable issue as to whether or not, Black women are adequately protected in birthing spaces, birthing hospitals right now. We already know that they are not. And so it feels like the only ethical thing to do is to put into place right away things that we know will literally save lives. And so, but this is not going to work if we don't adequately fund it. And right now where we're at is that California has not allocated enough money to this measure. And as a result, the reimbursement rate for the doulas is too low for any human being to be able to live off of. So what that means is that even though technically doulas would be available through Medi-Cal, nobody would be able to access it because doulas wouldn't be able to sign up for that level of reimbursement. So one of the recommendations says that we need to adequately reimburse doulas and midwives that are seeing patients through Medi-Cal. And I want to really reinforce how important that is. This isn't even about the midwives, although it's really important, but it's also about people who want to choose to have a home birth. Right now, you can't do that if you have Medi-Cal. And you know that birthing in hospitals isn't necessarily safe. So that puts birthing people in an impossible situation. So for that reason, that recommendation feels really urgent to me. And it's something that folks can take action on right now, literally calling it the governor's office and saying like these things, SB 65 needs to be fully funded and we need to fund doula reimbursement. And then if y'all don't mind, I also want to talk about a recommendation on the other side of the page, which is really around county agencies and frankly, hospitals and any large institutions moving beyond just doing anti-bias trainings. Anti-bias trainings are the beginning, but they're not the end. And what I have found in my experience is that a training without some kind of system of accountability doesn't do anything. And so I think that the other recommendation I want to highlight is the importance of, if right now your institution is investing in anti-bias trainings or DEI trainings or DEIB trainings or however you want to call it, if you're investing in that, then you need to take that additional step to really connect to this training to actual action and accountability. And so I think that there are a lot of institutions that can create some accountability around that. Certainly county agencies should start doing that work, but I hope that all institutions that have that kind of systemic power can really look at how we can create accountability around racist behavior when we're doing these trainings.
Thank you, Zea. Yes, you better preach, okay? Yes, absolutely. This accountability piece is really important. It came up several times over this last year. We need to tie accountability to all of these recommendations so that we can make sure that they're being implemented. And not only that, we also need to evaluate what's being put out there. We can't just say, yes, we have this thing, right? But if it's not of quality and it's not producing results, we're not going to see the change that we want to see. And so thank you, Zea, for lifting that up. Incredible, important, critical. I wanted to
just add?
Yes,
sorry,
absolutely.
but I just want to add that, this seems like maybe it would be a hard recommendation, but the reality is that when we want to create accountability for hospitals around other metrics, we know what to do. Like we know how to create accountability for hospitals to prevent readmission bounce backs. And we know how to create accountability around, hospital acquired infections. We tie it to financial means. We make that data public. Like there are systems in place already to create accountability for large healthcare systems. And so there's no reason why we couldn't leverage some of those same mechanisms to create accountability accountability around making sure that Black women don't disproportionately die through a totally normal, healthy, natural process. And I don't think that that's too much to ask. And so I think it's just important that we all step out bravely and really think about, if we're advocating, what are we advocating for? It's not enough to just beg that there's a training. Like, we should advocate for actual accountability. And so again, I just want to reiterate that anybody could call any state level policymaker right now and say, hey, I want to create an accountability system for hospitals so that Black women can feel safe when they're giving birth. So just want to put in that plug for accountability.
Yes, and I want to lift up something that you just said, Zea, that's really important. Anybody can do something about this right now. I think that is also another beautiful and powerful thing about this work. We are giving clear instructions for how anyone can be a part of this road to Black birth justice. And so when you take a look at the report, you'll see a table, you'll see what's low-hanging fruit, you'll see what you need to maybe partner up and get some additional resources to implement. Okay, so anyone can do something about this. And if you need some extra help or assistance, reach out. We're here. There's plenty of us out here trying to do this work, okay? So all of you are, yes, thank you, right here. This is one of the tables. Thank you for pulling that up for folks to see. And again, the link is in the chat, so please download and share. That's another actionable thing that you can do right now, is share that out with your networks, share it with your agency, share it with your organization so that they can start on these right now. So
Yeah. May I jump in and just
yes.
say something? It's a little off topic, but kind of on topic. I just want to share, especially with the recommendation, I fully supported this being seen and heard. And I remember after my son passed, I was sent a survey on basically what happened. They're asking me questions on, what happened. And that was X amount of years ago, and I never heard anything back from it. And in 2028, I participated in another birthing survey, and then I participated in this one as well. And just to see the results, or to see that someone got back to it, to not have shared my trauma and my data, for it to go into the big cloud of information and to never see it come back. So I just want to say that I truly appreciate when the information comes back, that so then I know that I didn't share my experience in vain. So I just want to once again say thank you, because this is being seen and heard in these type of environments.
Thank you, TaVia. So all of our amazing panelists, all of you are coming from a place of lived experience, right? Of being a Black mom. And so based on your experiences, what would you say a system of care that centers Black women, what would you say that looks like based on your experience? And we can start with Sakari.
I am still resonating with TaVia's shared experience. Thank you for sharing your truth and being vocal. But what I would say is she took the words right out of my mouth. Black women and their family want to be seen, heard, respected, and understood, period, just like any other person. And so what the team that we lead in Solano County, what we say is, once you help the population that has all these disparities, you help everyone. So to answer the question, she must have options, right? That supports her birth plan, holistic practices that support overall health, midwifery, midwives, doulas, healing circles, fourth trimester care. And what that means is it doesn't stop once we have babies. That's when the real fun begins. And so what does that look like for caring for them? Financial stability. Most of, including myself, we have to go back and forth on whether we can stay off financially or go back to work. It is very important when I talk about financial stability that she provides, that she's able to provide her baby with human milk, breastfeeding, right? Breastfeeding, statistically say Black women don't breastfeed. I'm a mama that breastfed all 5 of mine. I have a 2-year-old that's still breastfeeding. And lastly, connect or be reconnected to her village. And I speak village tribal because that's where we come from. And so village can look like case management that focuses on her relationships, her health. And when I talk about her health, her overall health, her physical, her spiritual, her mental health is huge throughout the pregnancy after. And finances that she can share, grow, learn, resources. And I think it's also important. I'm not talking about any group, but I'm talking about a group created and facilitated by women of color. I want to see me when I'm in spaces that's talking about really intimate topics, and also including her birth persons. Fathers, partners do exist in this population. And so what I would say an ideal system of care for Black women looks like, for me, and I'm being biased, Black infant health programs. Why in California don't all Black women get referred to Black infant health? Let them decide, give them options on what they do. I also want to say the reality of babies being born too soon and too early is real. So what I talked about is the ultimate birth weights, 37 weeks and over, a baby 5 pounds, 5.5 pounds and over, but that is not always our reality. And so when I talk about, my ideal affirmation, I want it to be times 10 for our women that don't make it to birth, that have preterm deliveries, and that their babies are their babies don't make it. They also need to be kept and brought up in the system.
Thank you, Sakari. Let's go to Taleia.
Sakari, I'm like, I don't have anything to say. You said it all. I'm like, darn, I wish my name started with a B right now. No. Thank you so much. You said everything. But you said something that really stuck out to me. And actually, TaVia, you said it as well. Knowing who we are. I think oftentimes I just went to take my son to the doctor yesterday, and I could tell that his pediatrician spent amount of time looking at his history. So I want my level of care to look like you know who I am. And if you don't know it, then wonder why I'm being triggered by some of the things you say, or if you notice that my body is turned off by how you said something, there's a reason why. I am a mother of one live child who I am literally weaning. Today is day 3. Sakari, you just hit me. He's 21 months. And I am a mother of 3 children who didn't make it into my arms. And so because of that, my level of care comes from a place of not everyone is going to be able to hold their babies. So when I went into a room, I often had a lot of fear induced. When you put that monitor to my belly, when you put that monitor inside of me, I was concerned if there was going to be a heartbeat. So when I heard a doctor say to me, you're fine. Well, I hadn't been. If you would have seen my charts, you would see that's why. So that's why I left that doctor and went to someone who could be more sensitive to my needs. So I think you said it best. It starts in every trimester. I knew that I wanted to be a mom. I did not know that the 4th trimester was going to be the hardest, although everyone told me that. So I agree with you. The 4th trimester has to be the one. We need follow-up care. And when we go into our doctor's appointments post, don't make me feel crazy when I say to you that I cried yesterday, because help me understand that this is developmentally some of the things that are going on as my body and my hormone is changing. So that's another thing. Honor my birthing plan. And then if there are areas in the way of my birthing plan not fitting into the plan that you have as my care, tell me from a place of science, and also from a place, if I'm telling you I'm a spiritual being, come to me a different way, because what you're saying is not resonating for me. So honor my birthing plan, and at least give me the care or the concern of, well, here's why we want to shift your birthing plan a little bit. And then you said it, my family, I have to be honest with you, my sister has 2 children, now 3, but on her 3rd one who came after mine, I just assumed she was breastfeeding. So when I mentioned something to her about me breastfeeding, she was like, why are you doing that? It was discussed. What? My family, I just made the assumption. We need Black women to know that throwing, and I'm saying throwing because sometimes I had to get up here, putting our babies into our arms feeding them, nursing them, how normal and natural that is. And walking around showing no fear, no like, I'll go into your bathroom and sit on your toilet. No, my baby is hungry. Do you eat your food in this restaurant in the toilet? Then my baby's going to eat here. So we just need to show that I am human. Treat me, see me for who I am. My voice will be heard. And if you don't want to hear it, then just say yes. Yes to the things that I'm saying that I need. So that's where I'm at. Yeah.
Yes, Taleia. Let's go to Zea.
You know, it's funny, when you first asked that question, what I first was thinking about was like, oh, like post-birthing Bill of Rights in every single birthing room and have patient navigators. But then I realized that that's not what you asked. You didn't ask like, how can Black women survive our current system? What you asked is, what would a system look like that actually centers Black women? And so I had to like take a step back and I just, even just noticing like that is not, like, it's hard to even imagine that. I feel like the bar is so low that just even having a system that isn't, you know, like actively harming us would feel like such an improvement. But if it actually centered us, you know, I was thinking like that would look like, what would it look like if we treated Black women and other Black birthing people as if they were precious? If we treated Black babies as if they were the amazing resource to this world that they are, like things would look so different and it would be obvious. And then I realized that there are many communities who are treated that way. So maybe a system that centers Black women would look actually a lot like the systems we already have, except that they would work for us too. I don't know. I think that some people, a lot of people, at least in San Francisco, can have the exact beautiful birth that they were hoping to have. Like, that's not an infrequent experience. It's just an infrequent experience among folks that are melanated. And so I'm just trying to think about, you know, what would it look like if nurses treated you like this baby is like a precious gift to the world, instead of, you know, one more drag on society, which is so often like the nonverbal communication that we all get, regardless of who we are when we're Black and birthing. You know, what would it look like if providers, you know, were really like, how can we make this a beautiful experience for you? That's our priority. Like, what would that look like? And I'm having a hard time guessing at it, but that's, I think, what would happen if we really were able to center around the margins in this way when it comes to birthing.
I feel you on that, Zea. I do. Let's go to TaVia.
All right, so I don't know if you could tell, I was in church, okay? Church, it was some mic drops, it was some amens, it was a hallelujah choir, church, all of that above. And I just want to also give a shout out to my Greek sisters. I see you, Asor, and I see you, sis, okay? What would it look like? One would be more people that actually look like me. Again, 7 pregnancies, and not once did I have a nurse, CNA, doctor, physician assistant, nurse practitioner, none, none. And I do live in North Los Angeles County, the Antelope Valley, which is what I like to call a hot spot for African-American infant maternal mortality challenges, and we don't have enough people that look remotely like me on any level servicing. So that would be one thing that would be nice. That would be nice. And to be honest, to not be afraid. I have C-sections. To roll into the room and not have an anxiety attack. What's going to happen this time? Will anybody pay attention to me and notice how I am? I'm crying. To feel safe, I don't know how much more I can express. To feel safe, not be afraid, have people that look like me. I think you said it, Taleia, to provide science as to why we need to change the plan. Give me all the options. Also, that we are, most of us are some level of a spiritual being. Take that into consideration. Don't dismiss me if I say I'm going to pray about it. You might not understand it, but I got it. And then find me somebody else that might understand it, so I could feel comfortable in talking about my beliefs and why I'm going to wait this out to see what happens. That's what that would look like. Gosh, I wish we could have that now. And you're right. Dr. Zea, we should have it. It's nothing abnormal. It's not going to cost millions of dollars. Okay. Yeah, there's just no reason why we cannot have a safe, happy environment for us to have children, and then provided with the additional care that we're going to need in the fourth trimester. So yeah, that's my 2 cents, and I'm sticking to it.
Heard you. Yes, absolutely. I mean, I resonate with what everyone has shared. I am not a mother yet, but I think with coming to an understanding and learning what our reality is, there's a level of fear that I have when I think about what I may or may not go through. And I don't want to have that. I don't want to be afraid to birth. I don't want to have to think, will I survive? Will my children survive? I don't want to have to think that, but I do, because that is the world that we live in. That is our reality. And the fact that it is preventable, that we don't have to go through this, it's upsetting. It's upsetting. And so for me, I totally agree. What that would look like would be, there would be no fear. There would be excitement. There would be joy. There would be hope, right? I would feel amazing. I would feel like I'm walking into an experience where I'm going to come out happy and whole and healthy. I would love that.
Can I also add another point that I failed to mention, and I didn't hear it, but what that will look like is when our women get their positive tests in facility or midwife, they are celebrated. They are celebrated. They are celebrated. And I say that because sometimes in my work, the celebration doesn't start until they get into a case manager program. And this is my truth. The celebration should start wherever they get the first response. It should start whoever helped create that child, whatever circumstance it is. And it also needs to start with villages, because you know, we do history, but if we go a little bit further, we celebrated birth, because that's where it starts. We celebrate conception, and we celebrate when this baby comes. And often generationally, because of the racism and the racist practices, our families are not excited about a birth. There is a lot of trauma and healing to another mouth being fed. And so I just want to say it's a celebration. It's a celebration. Women that enter our program, we say, we having a baby, because we are. And we celebrate every step of the way. First trimester, second trimester, third trimester, fourth trimester, and when those babies are going to school, it's a celebration, because we don't know what that baby's going to be.
Okay, I got to jump in on that one. It needs to be a celebration. I want two things. One, since you're from Black Infant Health, I've never had Black Infant Health. Never. It was never offered to me. Two, I think we talked about this previously before, that when we do say we're pregnant and we're having another one, that we shouldn't be asked if, immediately provided birth control, or conversation about terminating the pregnancy when I willingly came in like, hey, I need to start my prenatal. And you're like, oh, did you want to terminate? Now, I'm not here to say that's what we should do, but when I am coming to you with a family plan, like we want to have X amount of children, I should not be handed birth control or things like that to keep me from having, or every time I go in to start my prenatal, your first question is, do you want to terminate the pregnancy? Like we should be celebrating. I know I was intentional about having children, and whether it is intentional or not, it should be celebrated.
Yes. I love that we brought the conversation to celebration and joy, okay? See how we do. So throughout our conversations, y'all, we have talked about the importance of resources. We've talked about the importance of building our village, right? That was a recurring theme throughout our conversations. It's not only important for someone's birthing journey and beyond, it's also important for the moms and the Black women who are doing the work of advocacy and change. right? So could you all highlight some resources for the audience around the Black women that are doing this work, like you all? Let's start with Taleia.
Hey, okay, so just to make sure I'm understanding the question, to name people or just some of the resources that have.
The
Yeah?
resources, yeah.
Okay, perfect. So I still use it's MAHMEE Mommy, which is just again another Black resource, maternal health resource. There's Every Mother Counts. I think it's called Every Mother Counts. Again, or Every Mother Counts, which again is another Black maternal health resource list type place where just if you don't know what you're looking for, there's stories, there's information, et cetera, et cetera. But really and truly, I think the best resource is our village. I pray daily for my village. I was, like I said, I had a baby in a pandemic, so I didn't have a village. So immediately when things started to open up, I felt like, or even while inside, I could feel myself losing myself. And I got immediately involved in Mocha Moms. I joined, I connected. There are doctors, lawyers, people who are in government, where I'm getting information from them, and I'm also getting into their ear and vice versa. We have to do that. I surrounded myself with women who look like me and are experiencing or have experienced something that I am going through or might go through. So to me, the best resource is that when I was going through some of my many losses, I went to a podcast that was called Sisters in Loss, which also had so much history and stories. And now, because of so many women who have either gone through miscarriage or stillbirth pregnancies, are now advocates for Black mothers and making sure that we are taken care of and provided for. So look into that podcast too, because I can't even count how many things I learned from that, in my rights and also just what I need. But beyond resources, really and truly, for me, I go to the church too. My spiritual practice is what got me through and continues to get me through my day to day. I do not step out of my bed without checking in with that place, connecting and getting that area right. And then when that's not enough, I go to my sisters who also pray for me and give me the strength so that I can come on panels like this and be as honest and transparent as possible. Yeah, so those are a couple of things that I do.
Thank you, Taleia. Let's go to Zea.
Well, the resource that I am super excited about is the Embrace program, actually out of UCSF. It's a program where they provide race concordant care in a centering pregnancy model to Black people. And it just, there are not very many things that make me personally want to be pregnant again. I have found being a parent a wonderful experience, but really like the hardest thing I've ever done. But sometimes when I see some of these Embrace mamas, I do wish that my prenatal experience could have been what they're providing, and just seeing the ways in which, since it's specific for Black people, they are really able to infuse some of the cultural technology that has gotten us through into their program, and really thinking deeply, not even just about the mamas that they're serving, but also the providers that take care of the mamas, because that work can also really be trying on people's spirits and souls. And so thinking holistically about the whole system, they have incredible results where their mamas are birthing healthy babies on time at healthy weights and, having very few C-sections. And so I wish that could be available to everybody, but in the meantime, I want to lift them up. And I'm not the only one who's a fan. I don't know if you guys saw, but the vice president definitely had to come and check him out a couple of weeks ago also.
Yes, BB Harris sure did come through. Let's go to TaVia.
Okay, so I was debating if I was going to share this, but I think specifically for my area, advocacy is one of those things that we don't have enough of, or a lot of people don't know how to advocate for themselves. So I actually founded a nonprofit last year called the Empower Them Collective, and the primary focus is to teach community members how to advocate in medical situations, because not only have I had the experience with birthing, but my mother's a renal kidney failure patient. And so over the years, I've had to advocate on her behalf to make sure she got her needs met. So the Empower Them Collective focuses advocacy, leadership, and entrepreneurship. So I think, I'm gonna give a plug that is one of the services that I am helping to see direct impact in my community, so that someone else doesn't have to have the same experience as I have and some of us have had.
Thank you. Let's go to Sakari.
I'll just start with the foundation that women lived experience. Most of the women on this panel are the experts, are the resources. Oftentimes when we go to the macro level, meso level, micro level, we look for experts to share the story of the real experts. And so I'll say the women, the mothers, the lived experience is really important. And then the community, right? I know that for a lot of systems and a lot of acronyms that's behind my name, I will be nothing without my community. I born and raised in San Francisco, Bayview. I am who I am because of that. And so community, but if you really want to get specific, because I believe, and I was a part of this, is just keep it real, right? The Black Infant Health Program, I stand behind that program, that I think every Black mother should have the option to know a Black Infant Health Program for her prenatal postpartum. In Solano County, we are very intentional what we do here. So Mocha Mama Thrive Group, parenting group for all mamas, Solano Hills, health equity for African American and Black lives in Solano. Some other groups that kind of just really made the way, because mamas are everything, right? We want a career, we want to join stuff, we want a nightlife, we want all that. And so some other agencies that I'll just throw out there that I think is really impactful is Stand in Peace International. Most of the traumatic history of our history that we go through, we're not in peace. And so sometimes when we're pregnant, that peace is birthed into our babies. That peace, that unsettling trauma is birthed into our babies. And so Stand in Peace. We have to get in peace and real with ourselves. Fighting Back Partnership, shout out in Solano County. They really stand behind our program and support. And then the SC Justice Group. This is another forum and another panelist, but the reality is that mass incarceration exists. So we have birthing mamas, we have postpartum mamas that are not on the street. And so this program supports all women with incarcerated loved ones, trans women, women that identify. And so I just want to plug that piece in, because when we serve a mom in postpartum and prenatal, we serve her with everything they have. And so that may be connections to incarceration, that may be connections to mental health. COVID-19 is real. And so COVID-19 has kind of taken the blinders off really what our mamas need and what they can or cannot have. And so I want to say everyone that's done the work for COVID-19 support and resources have really helped, because I did deliver in 2020 my 5th child. I say I'm done, but don't put that on record, right? But my 5th child. And when I was, doing my birth plan, getting ready to birth, and they shared with me, no one can be in the room. I'm like, well, say that in Spanish, because you got me twisted. I'm gonna let you know who's gonna be in a room, how they gonna be in a room, how I'm gonna birth my baby live, and what it's gonna be. And so they said, who is this woman? Do your research, because all Black women require that, whether they speak or not. So shout out to all the resources that I failed to mention in the report. Collaboration is real, and also bureaucracy, right? That we have to start from the top up, top down, but really with the mamas that are experiencing. Lastly, we create panels and create policies, and we have never asked the mamas. Shame on us. And I'll say that, shame on us. In my philosophy, that's why I'm representing as a mama, we start there before we do the work.
Come on, y'all, come on. Ooh, yes, 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 yes. I want to lift up what you just said, Sakari, around partnerships. That is also another finding in our report that we feel incredibly strongly about. This is not going to be just one person. It's not just going to be just one organization, one agency. It's going to take every single one of us working together, collaborating if we want to create change. Partnership is critical. It's critical to have success. And so I just wanted to lift that up. I totally agree. And for those of you who are watching, who are in the audience, before I move to our last question, we do have time for Q&A. So if you have any questions for our wonderful panel, please start putting them in the Q&A in Zoom, and we'll see which questions that we'll be able to get to. And so I want to ask our panelists, what's one closing thought that you want to leave our audience with? And I'm going to start with Zea.
I think the closing thought I want to leave us with is to kind of think about this term ally. I feel like so often people claim that term ally, and I think people claim it from wonderful intentions, but I want to take this opportunity to kind of redefine what I think an ally is, because it's not enough to just have the intention or the good thoughts. I think that if you're going to be an ally, it means that you're actually willing to take meaningful action towards the outcome that you're providing allyship to. And so it's frustrating when I hear people claim to be allies, but they don't actually know what the policies that we need to be advanced are. It's frustrating when I hear people claiming to be allies, but they don't know how to be respectful when they're in spaces with Black-bodied people. And so I want to kind of let folks know that, you know, to be an ally means to be putting something on the line in service of birth justice and in service of Black wellness. And when I say putting something on the line, I mean that means that you need to have the challenging conversations at work if you happen to work in a system that is involved in this. Or maybe you need to have the challenging conversations at the Thanksgiving table if you happen to be family members with folks who don't respect Black lives. Maybe it means that you need to take time off so that you can go and show up and do some of the political work that you need to do on special testifying days. But it's not enough to just say that I care about this. It's not enough to just kind of align your intentions around this issue. To be a true ally means to actually take meaningful action in partnership with the folks at the center of this issue. So that's my closing thought.
Yes, Zea. Yes, let's go to TaVia.
Okay, so I think in that same vein, I've been intensely in this advocacy work for Black birthing individuals for the last 3 years. I think Sakari, you said it as well, that those who are experiencing personally impacted by it are the experts. And I believe that. I love it. And when we look at the system of those who are doing the work, they look like us. But those who are running the work, when we get to the top, the leadership, there's a significant shift in the leadership. And so it's very discouraging when we hear systems and institutions and large organizations say, yes, you are the subject matter expert, but I'm gonna have somebody else supervise and really lead and facilitate this process. What are you really saying to us? You know, what are you really saying to us? And it's hard because I'm in places and I'm like, wait, she running this? You can't even begin to remotely understand and engage us on a real authentic level. And that goes back to that allyship, that know when to bow out gracefully, know when to decline the position when it's offered to you, because you're really not the best suited for the job. Now, that doesn't mean you're not educated. Don't mean that you don't have a good intent or a heart. However, comma, dot, dot, period, and everything else above, this ain't your space, you know? And I think we just really need to start holding large institutions and systems accountable. Don't address the issue, then we stop at the top of the leadership and say, nah, we're gonna give it to someone else. And it doesn't work because we see it. Those who are doing the work, we see it. And interesting enough, we do meet resistance as we go up to the top. Because when we need to have radical change, the leadership is like, I don't want to offend nobody. Or no, we can't. We need radical change if we're really going to see that safe, happy, loving, birthing experience, fourth trimester experience, a fully resourced. So we really need that to happen, where the leadership really is reflective of the people in the community that we're serving. Because believe it or not, we can solve our own problems if provided adequate resources and tools and interventions, give us a soapbox to stand on, the microphone to speak on, we can do it all. Okay, don't forget it. We are superwoman in a sense. Just give me what I need. I got this. I got this. So yeah, that's my mic. I'm gonna pass it on.
Thank you. Let's pass it to Sakari.
Ooh, preach. This does feel like church. I mean, goodness gracious. So I'll be matter of fact. If you are not part of the movement, you are part of the problem. And so what that means is it's bigger than data, right? Like our programs get funded based on data, based on numbers. And if we look at the folks that are going through it, the women, me, if you know my story, you can't put that in a data or a number. It boils down to thriving, right? There is potential to thrive. As Dr. Malawa stated, we have a touch point and accountability for everything we do. Our numbers and our data has said this for years, then what? And so I'll just say, the Black community would like to be heard with action. And so it's bigger than, like right now when I leave here, I'm hitting my chest, but then what? And also when you have an organization doing the work, then there's other organizations, the partnerships that need to collaborate. One organization cannot be responsible for all of the isms that happen in our Black community and population. Every day there's something, and one organization can't just hold it. So I'll say it very eloquently, unapologetically, if you are not part of the movement, you are part of the problem. And I would love to have those conversations and start there.
Yes, 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 yes. Let's go to Taleia.
I want to be a part of the movement. I promise you, Sakari, that's why I'm following you. I want to start with the story. I would say we have to tell our stories, and we have to tell our stories, not just to each other, but we need to our government leaders. Zea said it earlier, call, write, email. The more we, allies, people of color, BIPOC, doesn't matter, the more we tell our story, make demands, the more they're going to have to hear. And until we do that and not just listen and complain and not vote, then we're never going to be able to truly make effect and get a part of the movement that Sakari was just talking about. So please do that, email, write, make phone calls. That to me is the biggest takeaway. And then tell your story so that people can be like, well, yeah, that's true. That happened. And it's probably happening to her. 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 So that the care that is out there that I believe Dr. Lyons said earlier, or maybe was Zea, we can use it because it's already there. That's it.
Absolutely, absolutely. We have some questions that are coming in. I see a question from Breezy. She says, okay, how can we find more of y'all? Zay saying something. Zay, you want to answer that question?
Oh, I said, tell me, I also would like to know the answer to that question.
Write us, email us. We have a question from Carla. She asks, what is the role of managed care or health plans to serve as advocates and allies in this work? There are HEDIS measures and other metrics that should track the disparate outcomes when it comes to Black women and babies. Where is their voice in this discussion? Does anybody want to answer Carla's question?
Well, I want to say that one thing that's been really actually impressive to me is that we have a number of doula trials in California that are facing Black Black people in particular. And a number of those are actually being funded by health plans. So I can say in San Francisco Health Plan definitely helps fund SisterWeb. I know in the Inland Empire, the health insurance companies are working in Fresno, in LA. And so I think that one of the things that is impressive is that these managed care organizations can pilot something and show that this is doable. One of the ways that all of these pilots have culminated is that gave us a lot of important data to then push for Medi-Cal coverage of doula care statewide. And so I think that that's one really powerful thing. Something else though is that, managed care organizations belong to their own professional associations where they really have a lot of powerful policy voice. And so I think that, a lot of times that space is kind of thought about, how they can, protect the bottom line, but what would it look like if they also, really started to advocate for what patients need, especially because they have access to data in a way that many other people don't. Those healthcare organizations. And so I think that those are some important starting places. But lastly, I want to bring it back to what I was saying before, which is that, managed care organizations are the ones who in fact pay hospitals and doctors. And so, if you hold the purse strings, then you also have a lot of power to create systems of accountability. And so again, it would be so wonderful to see some kind of system that rewards healthcare systems that actually dignify and keep Black birthing people safe. And if there were a penalty for hospital systems that are unwilling to make the investments to make that a reality.
I would like to attempt to add a perspective to this dialogue. So I'm not sure if I completely got it, but I know in particular for Black Maternal Health Week, I was asked to speak to a managed care organization about my experiences in my region. And what that did was open up the personal dialogue between myself and the point of contact and other key individuals to start building that relationship and saying, hey, I'm in your area. This is a challenge I had with your organization, and I'd like to bring to the table some solutions of things that you guys can do. So I just want to also just advocate that sometimes it is a one-on-one dialogue, or at least to build that relationship to stay in your respective community and organization, that something needs to change. And so we are now having additional talks about what this might look like in my community. So not a huge drastic change, but it's a start. And from where I live and reside, a start is better than nothing.
And I'll speak to my position of showing up as a Black mama. I could definitely answer this if I showed up anywhere else, but because the way I show up, I'll just be very frank. The idea of the report, like there's so many things on different levels on how this can be addressed in the report, but then I think it also falls on the equity practices, right? And for example, if a mama, with the scenarios that was shared earlier, if a mama is struggling and she got a call before her meeting and she's 30 minutes late, what does that look like for the managed care health plans, right? I know in Solano County, after 15 minutes, that means that you are rescheduling, you are canceling. So I would say that that didn't happen to one mama, that happens to a lot of mamas in our population. So what are the equitable practices that are being made? We have it in writing, we have a lot of policies to support it, but are we listening? Again, I'm talking about the mamas that share their experience with case management and village. Are we taking those scenarios and building on those scenarios? Or are we saying, okay, we have a policy, it's shared, it's read, and then next year we have a new scope of work? So what I would say is, I think it's important that we learn from the women that's experiencing it. If you're like me, I'll say, well, who is the supervisor of the day? Who is the manager? Where can I go? Member services, where you at? Because this is not okay, because you don't know why it took me 30 minutes to come. And I don't think it's important for me to share my story if you cancel and I'm a high risk mom or things of that sort. So again, I would say any complaint, any update, anything in your policy that can be changed to support a population that data speaks to this. I'm not saying that we want different, we just want the data to match the practices. And so the practices is not going to be the same for this population because the births are not the same. So why would we give a standard practice?
That's right, Sakari. Yes, and I'm so glad you said that. That relates to another recommendation that we have in our report around data. It came up multiple times that the data that we collect it's not adequate, we don't use it well, right? And so how can we start to think about even changing the ways that we collect and translate the data, right? Do we actually ask about patient satisfaction? And do we ask it in a way that we can actually track that a mama is experiencing anti-Blackness, that she's experiencing structural racism? And then do we do some kind of quality improvement to make sure that that response or that unsatisfactory response is being translated into quality improvement? We don't, and we don't do that well. And so this is another area that came up in our work that we need to focus on. So I'm really glad that you mentioned that. Just a reminder for folks that are watching, if you have a question and you want to ask your question live, you can raise your hand and Selena will make sure that you are off mute so you can ask your question. You can also feel free to keep adding questions to the Q&A box on Zoom. So we also share in our report, and this came up in our conversations as well, that we should be lifting up Black women leaders, leadership, Black women leaders, period. And so does anyone want to share more on why this is important? Why do we need Black women leadership? And why is that important, especially for this work?
Come on, Sakari, I feel like this is something you need to speak to us about.
Why isn't I'll speak from the opposite end. At what cost, right? There's a cost when you have a woman, not only that does the professional work, the scope of work, the policies and procedures, but we can't turn who we are when we get off. So what I would say with that is at what cost? You know, what's the benefit for that woman to be felt, seen, and heard? How is the organization supporting her? How is her village supporting her? What does the burnout look like? Have you asked her how she feels today? Or are you looking at a 40-hour week? So I want to talk about, like, what's the cost of that? Because it's huge and it's big, and I'll do it for free. But then I also have a family to feed, you know, and so I always look at what's the cost. We talk about self-care. And I just was having this conversation with one of my students. Self-care is a new phenomenon, not for the work, because I am social work, but for what we always know to be true. Our ancestors had self-care. It's a little different now, right? Because they paved the way. And so, you know, what does that look like on a daily basis? How do we kind of do a body scan with ourselves on how we're feeling? And what does burnout look like? Because sometimes, often when we have women of color or people in power that's of color, there is burnout. And we talked about the seats and making room for other people. Sometimes that conversation needs to be had. And then just because I do the work, it's important to stay innovative. What's happening with the policy? How am I taking my personal time off to show up in spaces to represent myself? So I talked about it at a different lens, but it's definitely important. But at what cost? What does that look like? And how is that person supported all the way around?
Anyone want to add?
I do want to add, but I'm not sure, because I feel you. When we do get to those positions, the expectations seem to be way different than other people in those positions. I know in LA County, we are attempting to, especially under the lens of, you know, LA County employees, find better ways for Black employees to show up authentically. So I guess maybe redefining what leadership looks like that is going against the grain of white supremacy, in that our work environments were designed with this philosophy, right? So anything that we do, where if we show up authentically, we are going against that principle, that philosophy. So we need to redefine what leadership, success, professionalism really looks like with the people in mind. So I think that's the only thing I really want to add is that if we're going to have people in leadership, we need to give them the freedom to authentically show up as themselves, as opposed to making sure you're always prim and proper or using the right word or enunciating every syllable that, you know, that's not always us. And to have to always think in that mindset is very draining. So if we are, I do believe in leadership that really looks like the people that are being served, but I think we have to change in which the environments they're working in and the expectations. You can't have me go to war and not expect that I'm gonna be a warrior all the time. And I don't need to be pulled into the office to have a conversation about my tone. Well, you were talking about Black people dying on the birthday table. What was I supposed to say that, you know, politely? And we got to do better at I'm going to come with that same passion and energy because we are talking about life and death. So I think that's the only thing I want to add to that discussion.
I feel so validated right now. Thank you, TaVia. There's a reason why I'm like this. No, I mean, one of the things that I think a lot about when I think about the importance of Black women leadership is I think about the opposite. I mean, I think about how strange it would seem to everybody if, for instance, there were a health crisis in Beverly Hills and they put together a panel of all Black women to address that. That would be really weird to everybody, really, really weird. And yet nobody thinks twice about the opposite, about putting together a panel of all non-Black people to address Black health crises. When you think about it from the other lens, it becomes clear that there are certain lived experiences that really inform one's perspective on this issue. And those experiences are really important. I mean, for me, I went to medical school, and yes, that information is often helpful in this work, but what is also really helpful is the experience of growing up with a single Black mom in San Francisco, low income, and the experience of giving birth as a Black person, especially before they realized I myself was a physician. And these experiences, I think, you know, really keep me honest and clear about how this work needs to go. And all the time, there's other pressures about, you know, meeting the demands of institutions and what are the rules, but like none of these systems were built for our success and our survival. And that lived experience that I have is what allows me to see the ways in which these systems, in fact, were never meant to serve me, and we need to transform them in order for them to function for our community. So that's what I would add. And excuse me, let me save my puppy really quickly from making a mess in my room.
We have another question. Someone asked, how can we bring the voice of our fathers into this work? Would anybody like to answer that question?
Oh, sorry, go for it.
No, Taleia, go ahead.
We bring them in. Let's just start with that. We bring them in and we listen to them. I think a lot of times, especially when you come from, my family's from the South. I'm from Baltimore. I live in LA County, but the men didn't do anything. Get out this room, we're gonna take care of it. So when we actually realized I had a wonderful mom and a great dad who co-parented well. They were not married. I don't even know how I am here, to be honest with you, but they co-parented well, that when I was in the space of my dad was my advocate. He was the voice when in his home. And so when taking me to the hospital, they had to listen to him. They talked to him. So I think that's where we bring the fathers in, and we value their voice. If we don't value their voice, they're not going to want to be engaged. And if we don't also give them a sense of, I guess, partnering, then also they're not going to want to be engaged. So we bring them in by inviting them into our space, not necessarily saying, come in here and disrupt what we got going. That's not what I'm saying, but at least say, hey, this is what we've put in place as Black mamas, Black warriors, Black superheroes. We need y'all. We need our men to feel empowered as well, because if they don't feel that, it's easy for them to walk away. It's easy for it to just be, I was raised by my single Black mom. Instead, my story is, I was raised by my single Black mom, And then she dropped me off to my single Black dad.
I think in the same vein, especially with my second husband, who we had the last three, I've had my 3 children with the last 3. I started to train him on what questions I needed to be asked if something happened. And so definitely bringing them in and training them on the scenarios, what to look for. Don't be afraid to ask questions. I think that's the biggest thing that has been helpful, because as we continue to, raise our children, I can't always go to the doctor with them. So you need to know what questions to ask. I send a list, if this don't sound right, if it don't feel good in your gut, ask the questions, call me on FaceTime, but really making sure it's a partnership, and that we encourage the expectation of you being a part of the journey. And I've had to co-parent with my oldest child, who'll be 20 this month. Not have to, but I got the pleasure of co-parenting with my oldest child and his dad, and we've done a great job. But it was also, I see someone in the chat that says broke the cycle. Yeah, because it could, the situation didn't work out like we hoped it would have worked out, and I could have been better. He could have been better. We could have did the whole thing, but really being having a mature conversation like, this is our child, and what do we want for our child, and that means you have to be present and involved, and I have to be present and involved, and just having that understanding, and then educating him on things to look for when he's dealing with the medical team, or all the systems we have to interact with when you have Black children. Okay, because it's a battleground, unfortunately, not just in this arena, but quite a few of them. And so we need to make sure our fathers are properly prepared and empowered, and that we support them, and regardless of what maybe our relationship is with them, if we're not married to them.
I second what Carla's put in the chat. Don't assume fathers aren't around, right? Are engaged. Also, language matters. And my example with language matters, not asking if the dad's going to be there from a case manager or a village expectation. The language should be, I'm expecting you to be here. We're talking about your child. We value your opinion. If we're engaging mama and we're enrolling mama, we want you to hear what we're sharing with the mom about your child. So language does matter. And I always want to say Big Papa is the reason for the season. I do know, disclaimer, is science, makes it a little different, but partners, fathers, birthing folks, right? Maybe it's grandmother or maybe it's uncle, that it's important that we change the narrative on who we're inviting, because everyone doesn't have a father, but grandma there, grandpa there, their new partner is there. And so we change the language as birthing partner, because they're there. And I think language engages them. We just had a dad say, where's my enrollment? Well, I'm not being enrolled. I helped create that, baby. And it was a good question. Why are you not being enrolled? And then I also think looking into resources in the county of just spaces for partners, whatever that looks like, because they do have feelings and they do have input, but to assume that they're not around because you don't see them is a misunderstanding. They're there. And sometimes our fathers are working. And so how could we educate, even if we don't hear about the dad, giving resources for partner or dad or the supporting person to have in addition? If we're advocating on safe sleep, then we definitely need to make a safe sleep for birthing partners. If we're advocating for what to expect with school, we need to make that for the birthing partner. It's not just geared for the birthing person. And that is where I think engagement happens. And we do a lot with our flyers to engage fathers. And then I'll go back to the original. Have we asked partners lately? Have we asked Big Papas lately? What's the incentive for them engaging? Because it's their time and their expertise too. We need to incentivize them as well.
There was an article that came out in the New York Times a couple of years ago that was titled "The Stuff Good Dads Get Away With." And that article was everything for me, because part of what it talked about is this idea that to be a good dad, you just need to change a diaper twice in a day. And everybody is like, oh, you got a good one. So, yes, invite, yes, but I think we also need to kind of change we need to re-normalize what it looks like to be a parent, regardless of your gender in the parenting relationship. I mean, we need to like denormalize some of the toxic masculinity that makes it so that it's weird for you to, change a diaper or wash your baby or whatever this looks like. And so, yes, empower, yes, invite, but also like, I don't think that it's something that Black women need to do. Like, I also just want to remind folks that like, do you need to be invited in to recognize that it's hard out here if you're a Black child and like all hands need to be on deck? Do you need to be reminded that like waking up all night and breastfeeding is so tiring that maybe doing the dishes would be cool? Like I'm just saying, yes, let's make the language neutral, but also like, let's just normalize what it looks like to be a dad, regardless of your race and how you're going to show up for the work. So yes, but also come through. Do you really need an invitation? Come through.
Come through.
I just got to add to that because it's normalizing, but for those individuals who might need to have that conversation, I want to encourage you to have that conversation. We homeschool our 3 children. Myself and my husband, he homeschools on his 2 days that he's off from work, and I homeschool on the other days. And he wasn't initially supportive of that idea, but I kept having the conversation and I kept sharing why it would be beneficial and how important it is for your children to see you show up in this capacity. So I really just want this to be a plug for anyone who wants to start normalizing these behaviors. You got to start with the conversation and be persistent with the conversation and show why your children need to see you in these roles, because one day they will be caretakers, providers, educators, and they need to know that it's fine. Daddy doing the dishes does not make daddy any less of a daddy, or that he's educating you. In fact, it's just very empowering. So you don't have to homeschool, but I'm just saying, start having a conversation with your partner on how you would like them and what's your home. Because I grew up in a single parent home. And so she had to be superwoman and do everything. And I just wasn't taking on that role. I got married. So that means we're going to be splitting this 50-50. So.
TaVia, you just said exactly, because I so agree with both what you're saying, Zea and TaVia. It's just that the invite, because I had my husband, my partner, had to, in a colorful conversation, inform me, well, the reason why you're not getting as much help is because you keep telling me I'm not doing it right. So I had to back up and go, you are now allowed to begin doing the things that you want to do. And I will do my best not to correct you. So that's why the invite is also there. I also use, and it did change my thinking, the Bradley method. I don't know if anyone's ever heard of the Bradley method, but when instead of doing Lamaze, and it was really geared on coaching, and it did talk a lot about like, hey, your partner, your husband. In my class, it was women, and our spouses, our husbands. And so my husband, since I didn't have a doula, he was my coach, and he turned to my care team and said, no, that's not what she wants. What we would like is blah, 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 blah. So I did also want to say that some of the men are invited. What the men also have to do is to turn to their fellow men who are like, yo, you change diapers, you're doing all that. And instead of being like, I'll do as one, literally say, you don't, and turn it around. So that's how we are, I think, changing the norm and saying, look, wake up. This is a partnership, and partnership actually means equal work, or if not equal, a balanced sense of, the work.
And I appreciate you for being transparent and say that you had to release yourself from the expectation that he do it the way you want it done. And that was a conversation I had to have with myself, that, it can't be done my way. But that also encouraged more dialogue about what is a way that works for both of us, as opposed to it just being my way.
We are out of time for questions, and so apologies if we weren't able to make it to your question, but I just want to give a huge thank you to our panelists for sharing space with us today. I have so much gratitude and love for you all. Thank you so much. Thank you so much. And there's still more to come.